If you have type 2 diabetes or prediabetes and your doctor is only checking your A1C, you're definitely missing the full picture. There are 10 blood tests that can tell you exactly what's happening in your body and, more importantly, what you need to fix. So today I'm breaking down all 10 tests, what they measure, why they matter, and what your results actually mean. I'm Diana. I'm a registered dietitian, a certified diabetes care and education specialist, and I have my master's in nutrition science. My whole mission is to help you reverse insulin resistance at the root cause, not just manage symptoms. So let's dive in. So here's the thing. Diabetes isn't just about blood sugar. It affects your heart, your kidneys, your hormones, your inflammation levels, even your stress response. And if you're only tracking one or two markers, you're flying blind. These 10 tests give you the full roadmap. Some of them your doctor might already be running. Others you might need to ask for, but trust me, they're all worth it. All right, let's start with the most common one, fasting blood sugar. So fasting blood sugar is a pretty straightforward test. It measures your blood sugar after you haven't eaten for at least 8 hours. That's why it's done first thing in the morning after an overnight fast. So why does this matter? Because it shows you how well your body is managing glucose when there's no food coming in. If your fasting blood sugar is high, it means your liver is overproducing glucose or your cells aren't responding to insulin properly. Both are signs of insulin resistance. Here's what they mean. A normal fasting blood sugar is going to be under 100 milligrams per deciliter, and a fasting blood sugar that's 126 milligrams per deciliter or higher indicates type 2 diabetes. Now, a lot of people think if their fasting blood sugar is normal, then they're in the clear, but that's not always true. You can have normal fasting blood sugar and still have insulin resistance. That's why we need to look at more than just this one test. But it's a good starting point. If your fasting blood sugar is creeping up, it's a sign your body is struggling to regulate glucose overnight. The good news? This is one of the first things that improves when you start eating more fiber, you start moving your body, you reduce saturated fat. We have a ton of videos addressing this. I will link one right here. I'll also link it below this video. So next up is HbA1c. This is the gold standard for tracking diabetes. An HbA1c, or an A1c for short, shows your average blood sugar over the past 3 months. It's kind of like a report card for how well you've been managing your blood sugar day in and day out. This test measures how much your sugar has attached to your red blood cells. The more sugar in your blood, the higher your A1c will be. And here's the breakdown. An A1c of 5.7 to 6.4% indicates prediabetes. And if you have an A1c that's 6.5% or higher, that indicates diabetes. Now, if you're already diagnosed with diabetes, your doctor probably wants your A1c under 7%. But honestly, the closer you can get to 5.7% or below, the better. That's where you start reversing the damage and lowering your risk of complications. The cool thing about A1c is that it's not just a snapshot, it's a trend. So if you're making lifestyle changes, this is the test that shows you if it's working. When people start eating high fiber meals, doing resistance training, and cutting back on saturated fat, their A1c drops, sometimes pretty dramatically. I've seen people go from 9% down to 6% in just a few months. But here's the catch. A1c doesn't tell you why your blood sugar is high. It just tells you that it is. That's why you need other tests, which we'll go into in this video. All right, test number 3, GFR, or glomerular filtration rate. This one checks your kidney function. Your kidneys are like filters. They clean your blood and get rid of waste. But when blood sugar is high for a long time, it starts to damage those little filters. And once your kidneys are damaged, it's really hard to reverse. That's why catching this early is so important. GFR measures how well your kidneys are filtering waste. The higher the number, the better. Here's what you want to see. Normal is 90 or above. Mild kidney damage is 60 to 89. Moderate to severe damage is going to be below 60. If your GFR is dropping, it's a red flag. High blood sugar, high blood pressure, and inflammation all damage the kidneys over time. The good news, improving your blood sugar control and lowering inflammation can slow or even stop further damage. This is one of those tests where early detection makes all the difference. If you catch kidney issues early, you can protect your kidneys before it's too late. Okay, test number 4, a lipid panel. This test looks at your cholesterol and triglycerides. And if you have diabetes, this one is critical because your risk of heart disease is already higher. So the lipid panel measures 4 things. Total cholesterol, so the overall amount of cholesterol in your blood. Ideally, you want to be under 200 milligrams per deciliter. Then we have LDL cholesterol, or bad cholesterol that clogs arteries. You want to be under 100 100 milligrams per deciliter. However, if you have diabetes, ideally you want to be under 70 milligrams per deciliter because you are at a greater risk for heart disease. Okay, the third thing it measures is HDL cholesterol, or good cholesterol that protects your heart. Above 40 for men and above 50 for women is where you want to be. And lastly, triglycerides is a type of fat in your blood, and ideally you want to be under 150 milligrams per deciliter. The good news is that many of the same tactics to reverse insulin resistance also help to reduce cholesterol as well. Eating more fiber, cutting saturated fat, building more muscle. By doing all these things, your lipid panel will also improve. I've seen people drop their triglycerides by 100 points just by changing their diet. So if your lipid panel is off, don't panic, it's fixable, but you need to know your numbers so you can track your progress. Okay, quick pause. I know this is a lot of information so far, and honestly, blood tests are just one piece of the puzzle. The real magic happens when you take action on what you learn. And that's why I created a free checklist with the top 10 daily habits to reverse insulin resistance naturally. Because supplements and blood tests are tools, but your daily habits, that's where the transformation happens. If you want the checklist, just comment the word checklist below and I'll send it straight to you. It's completely free. All right, let's keep going. Test number 5 is a C-peptide test. This one's a little less common, but it's super valuable. A C-peptide test tells you how much insulin your pancreas is still making. When your body produces insulin, it also produces something called C-peptide in equal amounts. So by measuring C-peptide, we can see how much natural insulin production you have left. So you may be thinking, why does this matter? Well, because type 2 diabetes is progressive. Over time, your pancreas can get worn out from overproducing insulin to compensate for insulin resistance. If your C-peptide is low, it means your pancreas is struggling a bit. But here's the thing, if you catch this early and reverse insulin resistance, you can take the pressure off your pancreas and preserve your natural insulin production. But if you wait too long, you might lose that ability. So if your doctor hasn't checked your C-peptide, ask for it. It's especially important if you've had diabetes for a really long time or if your blood sugar is really hard to control. This test helps you understand where you're at and what to do next. Okay, number 6 is fasting insulin. Most doctors only check your blood sugar, but your insulin levels can be high for years before your blood sugar even goes up. And that's because your pancreas is working overtime, pumping out more and more insulin to keep your blood sugar normal. Eventually, it can't keep up, and that's when your blood sugar rises. Fasting insulin shows you how hard your pancreas is working. If your fasting insulin is high, it means you're insulin resistant, even if your blood sugar looks fine. But in a way, it is good news because you caught it early. You can reverse insulin resistance before it turns into prediabetes and then type 2 diabetes. And the way to do that, again, high fiber diet, resistance training, less processed foods, managing stress, and getting good sleep. The fasting insulin test is a game changer because it shows what's happening before your blood sugar even spikes. Okay, test number 7 is a CRP, or C-reactive protein test. This one measures inflammation in your body. Now you might be thinking, what does inflammation have to do with diabetes? Well, a lot. Chronic inflammation makes insulin resistance worse. It interferes with how your cells respond to insulin, and it increases your risk of heart disease, fatty liver, and other complications. CRP is a marker of systemic inflammation. The higher your CRP, the more inflamed your body is. If your CRP is high, it's a sign that something is driving inflammation in your body. It could be your diet, especially if you're eating a lot of ultra-processed foods and saturated fats. It could be stress, it could be poor sleep, or it could be excess body fat, especially around your belly, which is also called visceral fat. I have a whole video on how to target visceral fat. You can check it out right here. But the good news is inflammation is reversible. When you eat more anti-inflammatory foods like fruits, vegetables, whole grains, and omega-3s, and you reduce saturated fat and refined carbs, your CRP drops. I've seen it happen over and over. So if your CRP is elevated, don't ignore it. It's a warning sign that you need to address inflammation to protect your long-term health. All right, number 8 is vitamin B12. This one's especially important if you're taking metformin. Metformin is one of the most common medications for type 2 diabetes. It's effective, it's safe, and it helps lower blood sugar. But there's one side effect most people don't know about. It can lower your B12 levels over time. And B12 is essential for nerve function, energy production, and making red blood cells. So if your B12 gets too low, you can develop nerve damage, fatigue, brain fog, and even anemia. If you're on metformin and your B12 is low, talk to your doctor about supplementing. A lot of people feel much better once they get their B12 back up. Even if you're not on metformin, it's worth checking your B12, especially if you're eating a more plant-heavy diet, since B12 is mostly found in animal products. Okay, test number 9 is vitamin D. This one's huge for blood sugar control. Vitamin D isn't just about bone health. It plays a major role in insulin sensitivity, immune function, and inflammation. And studies show that people with low vitamin D are more likely to develop type 2 diabetes. And if you already have diabetes, low vitamin D makes it harder to control your blood sugar. Here's what you want. An optimal level is between 40 to 60. Deficient is below 20. A lot of people are low or deficient in vitamin D, especially if you live in a place with long winters or you don't spend much time outside. But the good news is it's an easy fix. You can easily supplement with vitamin D3 and your levels will come up. If your vitamin D is low, getting it back to optimal levels can improve your insulin sensitivity and help you manage your blood sugar better. And finally, test number 10, cortisol. This is your stress hormone. When you're stressed, whether it's physical stress, emotional stress, or lack of sleep, your body releases cortisol, and cortisol raises your blood sugar. It tells your liver to dump glucose into your bloodstream so you have energy to deal with the stress. But the problem with that is that if your cortisol is chronically elevated, your blood sugar stays high, and this makes insulin resistance worse. Cortisol is usually measured with a morning blood test since it's naturally highest in the morning, but some doctors will do a 4-point saliva test to see how your cortisol fluctuates throughout the day. If your cortisol is high, it's a sign you need to manage stress better. That could mean better sleep, meditation, walking, yoga, or just setting boundaries in your life. Stress management isn't optional when you're trying to reverse insulin resistance. High cortisol will sabotage all your other efforts. So if this test comes back high, take it seriously. All right, we just covered 10 blood tests. That's a lot, but here's the truth. Knowing your numbers is just the first step. The real transformation happens when you take consistent action every single day. That's why I put together a free checklist with the top 10 daily habits to reverse insulin resistance naturally. These are the exact habits that lower your blood sugar, improve your insulin sensitivity, and help you get off medications. If you haven't grabbed it yet, just comment checklist in the comments and I'll send it your way. It's free, it's simple, and it works. Okay, and here's my challenge for you. If you haven't had these tests done recently, talk to your doctor. Ask for them. I've listed them below in the description. Print this list if you need to. You might be surprised that insurance will cover a lot of them. You deserve to know what's happening in your body. And remember, diabetes isn't just about managing symptoms, it's about reversing the root cause. When you address insulin resistance, reduce inflammation, support your kidneys, balance your hormones, and manage stress, your body can heal. You don't have to do this alone. We're here to help. So drop a comment, let me know which test surprised you the most, and don't forget to grab our free checklist. Thanks for watching, and I'll see you in the next video.